I'm Dr. Michael Flynn, a fertility specialist at Queensland Fertility Group on the Gold Coast. Welcome to Fertile Minds. Today, we're going to talk about our chances and what happens with regards to twins in association with an IVF cycle. IVF treatment has often been linked to multiple births in the media and talk around, but in truth, this is really just history now, because today, twins really is not an issue. Explaining that better, back in the days when we had not near as good IVF success rates as today, we often would put in 2 or sometimes, historically, even 3 embryos to try and increase our chances of success. These 2 or 3 embryos did often end up as multiple pregnancies, which had complications associated with it. So today, with our improved success rate of IVF, we only put in a single embryo routinely. There are definite times when patients ask that I'd really like to have twins. And I must admit there's some romanticism about that. But if I put my doctor hat on and my obstetrician hat on and looking after women during their pregnancy, the risk of complications with twins as compared to a single pregnancy significantly changes. All the complications with twins are mostly due to premature delivery, and seeing twins in the intensive care nursery is not something we want. So, if at all possible, we won't put 2 in just on that whim, and in the few reasons that we would like to increase our chances because it's not working, there are definitely alternatives to putting 2 embryos in today, such as testing of the embryos, and putting a chromosomally normal embryo in with PGT is sort of the same effect, that it gives an increased chance of success, but without the risk of multiple pregnancy. I'm asked, though, if we put an embryo back in, can twins still happen? And the answer is yes, because there's 2 types of twins. The twins that are non-identical, or one's a boy and one's a girl, can only happen when there are 2 eggs and 2 sperm and 2 embryos. Now, if we put a single embryo back in, that type of twins is not going to happen. But the second set of twins that you know of is identical twins. And identical twins is a single embryo that at some stage splits apart into 2. And that's why everything is identical. And when we put a single embryo back in with IVF, there definitely still is the possibility that it can split, and so you can have identical twins with a single embryo transfer. So what are the risks of having twins with IVF? Well, if I put a single embryo in truth, the only way we can get twins, as we discussed, is if that embryo splits into 2 and we have identical twins. And the chance of that is less than 1%. And so what say I do have twins as a result of my fertility management? Well, twins we would definitely call a high-risk pregnancy. And that's not to say that things are going to be a problem, but that's to say will be managed and looked after a whole lot closer. Obstetric care and antenatal care in pregnancy will involve a lot more scans and a lot more close watching. It's pretty easy in antenatal care to feel the size and look at a single baby, but when there's 2 involved, we need further ability to see that both of them are happy. So antenatal care changes, you'd have to talk to your obstetrician and delivery, but often the mode of delivery changes with twins. And certainly taking babies home is different to a singleton in that you will need help, because 2 babies are definitely much more work than 1. Thanks for watching. Don't forget to subscribe for more fertility insights and expert advice.